Hello viewers of Free Nursing Course channel. We meet again in the second part of the Spinal Deformity lecture. Assalamualaikum warahmatullahi wabarakatuh. In this lecture, we will discuss about the angles of lordosis and kyphosis, signs and symptoms, and then the diagnostic tests of lordosis and kyphosis. Normal angles of our backbone in the thoracal vertebrae is 21 to 33 degrees. It is measured from thoracal 3 up to thoracal 12. And then in the lordosis that happens at lumbal, the normal angle is 31 to 50 degrees. It is measured from lumbal 1 to lumbal 5. We know that everyone has a degree of normal curvature of the vertebrae or the backbone. The spine's natural curves position the head over the pelvis and work as a shock absorbers to distribute mechanical stress during movement. The kyphosis is diagnosed if the angle is more than 50 degrees, according to American Academy of Orthopedic Surgeons, or AAOS, but Mayo Clinic gives a lower diagnosis for kyphosis, which is 40 degrees or more. Let's continue to the signs and symptoms of kyphosis and lordosis. If you have kyphosis, you might look like the main character of the Hunchback of Notre Dame. So the back is round or hunched, and then you might experience mild back pain, fatigue, tenderness of spine, stiffness of spine, tight hamstring muscles if Scheuermann's disease is the cause of the kyphosis. So the hamstrings muscles are three muscles of rear in the rear side of our thighs, consists of semitendinosus, semimembranosus, and biceps femoris. Now you might feel tight hamstring muscles. And then in the severe cases, you might feel difficulty in breathing because of your expansion of chest is limited because of stiffness of your thoracal vertebrae and the stiffness of your muscles. And then in the lordosis, people with lordosis has a sway back posture when they are standing. The belly appears to sag forward and their pelvis tilts forward to compensate. And then exaggerated posture, like you might want to start a fight like that. And then the buttocks look more prominent, and then you might feel low back pain, and then when you move it causes pain, a slight pain, and then sometimes it is associated with pregnancy, but it is decreased nowadays. And then the most or the easiest to recognize is there's a space between your lower back and the surface when you're lying on your back if you have a lordosis. How could a doctor diagnose kyphosis and lordosis? Of course, the doctors will do the physical examination to confirm abnormal curves and then palpate of abnormalities, and then measures your range of movement, like flexion, extension, and lateral flexion, and then neurological evaluation. If you have weakness and then paralysis, how is your sensations, and then is there any changes on bowel or bladder uh, excretions, and then you will undergo the spine x-ray to determine severity of curve, and maybe it is needed to do MRI to test for tumors, infection, or neurological symptoms. And then to assess effect on breathing, you might having pulmonary function test or spirometry test, when you have to inhale maximum and then exhale as strong as you could, and then the the result is uh, measured to know how is your capacity, or your breathing capacity, or your lung capacity. In the lower doses, very much the same. The spine x-ray will be done from anterior posterior, and of course the side or lateral side, to measure the degree of the curvature of your lumbar vertebrae. And then the MRI might be done to check the spinal cord. Is there any defect of your spinal cord because of the lordosis that can be affecting your lower extremities function? Okay, that's all for this lecture. If you have any question or discussion, you can type in the comments box. See you in the next lecture. Thank you. Assalamualaikum warahmatullahi wabarakatuh.